Good morning, everyone. Welcome to the second day of the Silver Echo Festival. I hope you all enjoyed the first day and last night. I have the pleasure to start with this panel together with two distinguished colleagues, and we're going to talk about the residences of tomorrow. We want to talk about both senior living facilities and care homes and how they will look like in the future. How is AI and digital technologies disrupting these facilities, and what are the opportunities and challenges that we face now and will probably be facing in the future. So the main question is how we want these facilities to be more efficient, but at the same time, how we can make them more human and more connected. My name is Stella Shiroka. I am based in Vienna, Austria. I work as a consultant and researcher for designing research and innovation projects for building digital tools for the healthcare sector. And we work on co-design and integrating the user perspective at an early stage. We designed the whole innovation process in a way that it's agile and stakeholders are all the time involved in the process and measure the impact that these tools have on their users once they are implemented. And as I mentioned, my two distinguished guests are experts in the field. First, we have Frank Lehausen from Germany. He's the director of Reifegrad 4. A long-term expert in the silver economy, a demographic expert, and organizer of the Senovation Awards in Germany. He'll talk about himself more later. Then we also have Carlo Cavandoli from Italy.
Good morning.
He is partner of the SPECT Group in Italy, an international company that designs and maintains senior living facilities of independent seniors, both in Italy and in Germany. And he'll tell us more about their design concepts and how they're integrating new technologies into their residences. So I'd like to structure the conversation into both the opportunities and risks that digital technologies bring when implementing in the senior living facilities and in the care sector. First, let's focus on the opportunities. So what's the huge opportunities that AI and such technologies bring for the care sectors? We know that the care sector is facing the huge burden of staff shortage and staff being overloaded. And on the other hand, for senior living facilities, for example, we have the risk of isolation and loss of cognitive stimulation. So digital technologies have the impact to improve all these burdens, but at the same time they bear a lot of risks. So let's focus on the opportunities. Carlo, since you are already designing the residences of tomorrow, tell us a bit more about your innovation strategy. So how do you choose which tools you want to integrate into your care facilities? What's your procurement strategy? How you look into the impact that these tools have for the residents?
Okay, thank you for the question. I think the most important thing for us is that we concentrate on guaranteeing autonomy for our guests and training our staff, which I think is the most important thing, because if you introduce a new technology and the people who are going to use it for the residents don't know how to use it, has a very short lifespan, because if you introduce a technology and the staff doesn't know how to use it, there's no point in introducing it. What we do now is we are introducing Alexa we have a partnership with Amazon, and we have personalized Alexa devices for our residences, and we have integrated as well some motion and depth sensors in the Alexa machines, so that they can detect falls and they can detect rises in temperature. And the Alexa machine, it guarantees a sort of autonomy, and it allows our residences to talk to the machines, to the AI, and yeah, we are personalizing these devices to be able to give independence to our residences.
Could you tell a bit more about design concepts? How are you working on making these residences also more human, more interconnected?
We are again, like I say, we guarantee to our residents to be able to stay in community. So we have these activities where we use the technology a lot in the common areas, and yeah, we have all these activities like sports and singing activities and games and chess and card games, and we use the technology to allow our residents to be able to interact with each other, and yeah.
Thank you.
You're welcome.
Then I'll turn to Frank. From your experience, and especially in the German context, which tools are currently being implemented or developed? Which are what will be the future of these tools, and what do you think are the main opportunities in the care homes?
I think we like to differentiate between administration and caregiving. So in Germany, the rule is 1/3 of the time a professional caregiver is spent on documentation. So there are a lot of digital tools now, for example, a speech tool where the caregiver can just talk into their mobile, and the AI will create digital health records. So they don't have to go to their office and type it into the system. That saves a lot of time, and they could spend this time with the patient or the caregiver. That is something we're really looking for, that we could drill down the crazy administration we have in Germany for documentation, and that is going on in different ways. So I really appreciate that we could take the burden from the care personnel to the technology. And the second thing is like the care itself, like you said with Amazon Alexa or something like that. So we really like to see more autonomous moving or behavior within the facility, and we have a lot of tools which could be fault sensors, fault detectors, could be robots who do service, could be also dispatch services overnight, that machines, AI really could track behavior, temperature, movements, to really focus the caregivers in the areas where activity is needed. And it's the randomly check and open doors and wake up people just because they assume there might be something going on.
Would you also like to mention some concrete examples maybe of such innovations? I know you are working on some of them, so maybe for everyone to know.
I think what's interesting for us also, as we have a very good social security system, we have a long-term care insurance, which is for everybody. And for me, always when we talk with startups, you have to make a decision. Want to be a reimbursed product or out-of-pocket solution? Because if you're out of pocket, you're less regulated, and if you are in the system, you have to do much more evidence tests. So that's also a strategic decision for startups in our country. And we have two good cases. One is Voice, which is this app where you could talk to your machine for the documentation. And they raised now $9 million funding in the Series A because it's an international problem that the documentation takes so much time for caregivers. And on the second side, we have a kind of self-made Alexa tool, which is an AI companion, which also do pill reminder stuff and which also works together with a radar fall detection. And that is the first digital tool we have on the reimbursement scheme. So we see also that if you talk about reimbursement, the administration has to understand digital tools, which is also new for them. And so we see also a slowdown and eligibility of digital tools to administration for the insurance, which don't understand how to rate, how to test digital solutions. So that's two pretty new cool things we could see. And that gives me hope that also our insurance system and social insurance agencies see the digital change and understand it.
Thank you. I know that voice was also implemented in Austria, and I heard that the staff feedback is very positive. It can save up to 1 hour a day of documentation that was previously going into documentation since the nurses directly...
Is it a product that you made?
Yes.
We run a startup award, and they won it 2018 or 2019. So we have a good overview what's going on in the German, Austrian, Switzerland market. And it's good to see that our winners get successful. So
is it multilingual?
Yeah.
Okay, maybe send me an
We can
email.
talk.
Yeah, we can talk.
Yeah, it's another one maybe I mentioned. It's called Care Table, and it's like a huge tablet you could use in your facility, and they could play board games, and you could also do documentation and questions about it. So there are a lot of ideas, but the implementation is really the key thing, as you mentioned.
Is it visual? Is it like tablets?
Yeah, it's really like an XXL tablet. And as you mentioned, for me the most important thing is that you introduce the technology to the caregivers and the people in need of care, and that falls a bit short in a lot of houses. So people say they buy digital technology, they drop it down and then enjoy. They won't work.
A lot of our residents are scared to use the new technology because they don't understand. They see this big thing, all these complicated menus, and for them it's like a shock.
Yeah.
But slowly, the future generation of seniors will be more tech savvy. Because we grew up with technology, so we would know how to use it in the future. But the current generation of seniors are a little bit wary of using new technology because they don't understand. They're scared to make mistakes.
Yeah.
But I always tell them, what's the worst thing that can happen? You're going to call somebody without wanting to call them. It's not.
Yeah, 100%. We see it's the same with the nurses. So what we also like to have a tandem within the nursing. So you have a young nurse, which is more digital fluent, 100%. And you have a more experienced nurse who's got the social skills, how to deal with complaints or something. So you could have a tandem where young teach old and old teach young, and it's really important for us to get the skills for all caregivers.
It's important to have both right now.
Yeah.
Both the human touch and the technological touch.
I think it's the only thing it could go. Nobody wants to have 100% digital care, and nobody could afford 100% personal care. So somehow we have to find a balance.
Right. Okay. Then I'd like to talk about a bit the Austrian context as well, and especially the health context, which, I mean, it's kind of a different domain, but it will improving health in general in the future also is very much related to the care sector. In Austria, as I mentioned, we're also implementing a lot of digital tools for the nursing documentation, and there's a proliferation of these tools that integrate AI for documentation, and also have the interoperability option that the data that they include in the nursing file is attached to the electronic health records. It's attached to other health records and so on. So these have an immense potential. And then what's coming up in the future is precision and personalized medicine and apps that help us monitor our health parameters. These will increase the well-being of seniors in general, and then have the potential to improve the work of nurses. They don't have to go measure blood pressure 3 times a day, but it will be measured by themselves on these apps. Where, for example, at my institute, the Digital Health and Patient Safety Institute in Vienna, we're working on a major EU project called H2Train, in which we're developing, the partners are developing 10 new sensors that will be integrated into a wearable device that you can put on anywhere in your body, and it measures almost all vital health parameters like glucose level, cortisol levels, heart rate, blood pressure, and so on. And integrated with AI, this will give the user, but also the caregiver, an overview all the time of all the health parameters and analytics of that indicate that something might come up. So this has a potential to increase well-being.
Is it testing phase or is it already?
It's in testing phase, okay. Yes. It's an EU project. It's an EU-funded project. So it's at a very early stage, but there are also many other projects going in this domain. So they will be for our daily use, but in a care home, they have the potential to decrease the burden of staff members and give the residents an overview of their own health. What we're also working on in Austria and in several, we've also already seen that it's being implemented in several countries. I know it's also implemented a bit in Italy, is the home hospital. So in the future, these health devices will make it possible for patients to be in their homes and not go to the hospital for every condition. So there are health conditions that can be treated at home with a continuous monitoring from the doctors and nurses at the hospital. So the future of care homes will be that people will be more treated in the care homes and in the senior living facilities. And this has the potential, so all these AI tools that will do the monitoring and prediction have the potential to decrease staff burden. But there are huge potentials for this, but at the same time as they are at a very early development, we also face several risks with them. One of them is bias in AI, the accuracy. We all have tried ChatGPT and AI applications. They're not always 100% accurate. We have many cases in which the system hallucinates.
Hallucination.
Exactly. So this raises a lot of ethical and legal questions. What will happen if the system makes a mistake? We were currently testing AI applications at nursing homes. And for example, if the device measures blood pressure automatically, should the caregivers rely on them? Should they double check? And if they double check, does it mean that they are still doing the work? So there are a lot of dilemmas that go into their implementation. Then also it's a question of liability. So who is liable if the machine made a fatal mistake and the patient has an incurable...
Baby steps.
Yeah. So
Slowly.
We are at the very early development, right? But we have to take all these issues into consideration. So when it comes to the risks, I'd like to know your perspectives. Like, what do you think are the main challenges? We've talked a bit about the opportunities. What do you think are the main challenges of integrating AI and the future technologies in homes and care homes?
I think the risks are going to be less and less as the technology gets better and better. I think for now, what we try and do is we have this telemedicine service in our homes, and but we always tell the patients that it's an initial dialogue with the doctor who's virtually connected to you. But if the symptoms persist, or if you still don't feel better after a little while, then to go to the doctor, go to a physical doctor who can look at you and check you out, because even humans make mistakes. It's not just the machines that make mistakes. It's just that in the future, as technology evolves, it'll get safer and safer and safer. But for now, I think we should always double check. You can do the first check with the AI, with the machine, with everything, but then always get a human opinion.
Human oversight.
100%. At least for another few years, it's going to be like that, because you can't give total responsibility with your life and with your health to a machine. Not yet, at least. But it's inevitable. Sooner we'll have robotic nurses. You can see Elon Musk is doing what's the robot called? Anyway, he's doing a humanoid robot, which will be ready in the next 2-3 years, and it's going to cost 30,000 euros to buy one robot. And he doesn't need sick days, he doesn't need days off, he doesn't need family days. And I'm sure you can equip the robot with sensors to test people's health. So he'll be able to take your temperature to measure your blood pressure, and it'll be as reliable as a machine that we use every day to measure the blood pressure. So I think for the next few years, just take it easy, just don't rely 100% on the machines, and always get the human oversight, and the responsibility always has to lie with the human caregiver, not with the machine. You can't give responsibility to a machine, not yet at least. And also there's no laws in place yet to be able to deal with this. And then we have privacy issues, we have data issues, we have all the other issues that come with the European Union laws.
Yeah, well, the regulatory framework is still at the beginning of this. So we have the AI Act, but there are still many regulatory gaps, and at my institute, we're also working on this, on developing new standards for AI in healthcare.
Yeah, I agree. I think at the moment we have an assistant, so it's not really an autonomous program. So I think we have to like a double check. So you have the AI system and the human factor, which I think it's nice to get two perspectives. But what is for me more triggering is the human effect. So how could we convince patients and people in care, especially older ones, that the technology doesn't harm, it helps? You know, when you go to the doctor, there's a lot of social interaction within it if you do it with sensors. So will nobody talk to me? So I see a lot of people are kind of afraid if all this technology comes in, who am I? Will I be alone? And that's something needs to be a concept. So I think at the moment we focus on productivity, but we also have to talk about the quality of care. And if we can take this into account very early, like you do with your co-creation and user innovation, I think we find a way. But for me at the moment is a bit tech-heavy discussion, which is okay because we have a lot of checkout with the tech. But if you don't get the personal or human touch into it very early, you will come up with a super techie solution which is compliant to all the regulation, but the patient gets afraid what's going on.
For now, though.
Yeah.
Because now, like I see with my parents, they go to the doctor and they talk with the doctor for like 15 minutes, and they'll tell everything about me, about my brother, about my sister, and they'll, you know, it's like they have a chat with the doctor, and then after he does the checkup, and then he lets it go. But I think with the newer generations, the people who are used to using technology, it'll be that problem there will be less and less, and they'll appreciate more the efficiency and the quickness of having a tech doctor, of AI doctor, rather than having a normal human doctor. I think it's just a normal evolution of the species.
And another thing for me is, which I'm not 100% sure, everybody talks about prevention and want to have a long life, but nobody wants to get the hard data. So if you got all your sensors and your system says you have too many blood sugar or whatever, do you want to hear it? Do you want to know that you act against your health when you're eating pasta and drinking red wine? I'm not too sure how clear people want to be. So from the rational side, you want to live a healthy life, but we all drink, eat, have a good life. And if the data give you so much hard data and information, I'm very curious to see how that turns out and how the compliance with its tools will go on if you get not the data you expect to.
So data proliferation.
Maybe,
that we don't want.
Yeah. Do you really want to know the truth? It's the same thing if you ask people, do you want to know when you die? I think sooner or later I could tell you what's your really life expectancy is. Do you really want to know? I don't know.
No.
No.
Well,
Me
this
either.
100%.
This will be not mandatory. So the ones who want to know will use it. The ones that don't, then they will take off the device.
But we have what we call the longevity, what is the name? Paradox, a longevity paradox. So we all want to have a long life, but nobody's really taking care of it because we want to have a fun and a joyful life. And that is not per se a match.
But back to the residencies. Have you seen cases, both of you, in which technology was implemented and was not successful, that was not accepted by caregivers or the residents themselves?
I mean, there are different sensors. We have a lot of failure, too much positive or negative results. and then the home and the nurses get very crazy, because if you assume that the outcome of a specific sensor or tech is not correct because you have so many false positive or false negative results, that is a bit tricky. So when it comes to false sensors, or we have some smart mattresses which have micro movement detections, and you really have to communicate with the nurses that that is a test bed and this is a first installation. If not, they expect 100% accuracy from the tool. So for me, I think people are okay with if sensors don't work 100%, but you really have to be aware of it. If you create and sell a solution as a startup, which is the smart whatever thing, and you have a 50% failure rate with your sensors, that won't make any success. So I think it's what you expect. Expectation management with your product is more important for me at the moment than accuracy.
100%. And also we had we bought these iPads for the residents. We loaded all the magazines, all the newspapers, all the things on the tablets. It's a simple example, but nobody used them because they prefer to get the newspaper and to read the newspaper, the physical newspaper. But again, I think it's generational, and it will pass once the generations go forward. And also the sensors, the tech, and all the things, this current generation, they don't believe in what the machine says. Like when you put the oximeter to measure your blood oxygen levels, we saw during COVID, nobody trusted it. They wanted an opinion of a physical doctor to tell them, no, look, you have this, you have this, and you have this. But again, I think it's just a question of time and technology. And once, like you said, once the results start getting more positive than false positives, then it'll be a no-brainer. It'll be common knowledge, like the internet is now for us.
Yep.
It's just generation.
So if we think of the residents of the future for the next generation, probably, how will they look like? Not only in terms of technology, but also like design concepts. How will they be, like the structure and everything? So tell us a bit more about your future visions.
I think it's going to be, well, we're seeing it now with all the options we have now for the sensors in the home. Everything will be out of sight, and it'll be kind of like automatic. It'll be a lot less invasive. And we'll have sensors for everything, for falling sensors. We have them now in our residences, motion sensors. So if something falls really fast, our staff will get a notification that maybe somebody fell in the apartment. So maybe go upstairs and check if somebody hurt themselves. Well, everything will be autonomous. It will be seamless. You'll have in the morning. You'll wake up. You'll maybe put your hand in some technology, and it'll give you all your measurements. Like today, you slept well. You don't need to eat. You don't need to have breakfast because your blood sugar is fine. You can wait till lunch to have breakfast, to have something to eat. You'll have automatic moving panels on the floor where you can do the tapis roulant. You can walk in the mornings. You do your steps. It'll be 100% seamless. It'll take your temperature when you wake up. It'll be like you see in the films now, how they depict the future in 15, 20 years.
But maintaining, how will we maintain the human component? And
it'll be less and less. You'll talk to your kids, you'll talk to your friends, you'll talk to the other people in the structure. But the physical doctor, in 20 years, I think it will be something of the past. You'll have the specialist who will still do his specialized care, but the GP or the base doctor will be digital, will be a robot.
Carl, is that your Frank? Sorry, is that your vision as well?
I think we will have kind of two systems: the rich and the poor. I'm afraid. So if you're poor, you have no question. You get the full digital thing because it's very efficient and it works well. But if you're rich and you can afford it, you will have still your nurse and your personal assistant. And I think the senior living will be much more different, much more personal, because the boomers are more individualistic than the generation now, and they can afford it to have a more personalized home. So for me, it's a bit like two layers, rich and poor, so to say, and within that, the question of individualization. So how easy could we adopt to a specific need or a style? And I fully agree that there will be no 1984 vibes as today you have cameras and sensors, but maybe there are some people who don't want it and they would opt out, But for a efficient caregiving system for everybody, there will, like you said, a lot of
The state hospitals, the state nursing homes will be 100% technology, like Frank said. Like you see now in Dubai, if you go to Dubai in the streets, you have the robot police that takes pictures of you if you jaywalk or if you throw stuff on the floor, and they will give you a ticket straight away. It'll be the same thing in the state homes. You'll have the mechanical nurses, the humanoid nurses, whereas, like Frank said, in the richer homes, you'll have a personalized care. You'll have a nurse, a human nurse, who'll take care of you, and a human doctor who'll tell you what you have and what you don't have. It'll be a two-tier system, like it always has been. Like even now, it's a two-tier system. So it's not much will change. It will just be the people who you interact with will be less or will be more. Depends on how much money you can afford.
Well, if AI and technologies take us this work burden, then hopefully we'll have more time for human connections, and we can focus on each other and do the AI and robots do the work for us.
Yeah, I hope so. And I'm curious to see if intergenerational housing will go. In Germany, we have a program for intergenerational housing, which is a funding program if you set up a real estate and you put in young and old families, that they could create an ecosystem. But maybe due to the situation in our demographics, it will be the norm. So maybe we see much more mixed use of real estate with a kindergarten and a care facility under one roof or family. So that might be also a less tech-driven than society-driven opportunity. I'm not sure if it comes, but I'm very curious about the tests we do in Germany.
In our structure in Siena, in Tuscany, it's huge. It's 10,000 square meters. And we are in talks with the city hall to open a primary school there. Because the interaction between the two different generations is beneficial to both.
We have the same concept in Austria. It's implemented in
it's
many.
fantastic.
I love the concept. Yeah.
It's fantastic. So yeah, so it's for sure 100%. It'll be.
And that's I think it's a win-win for everybody. And as we have a lack of teachers and caregivers and also social interaction for older people, I think that might be a good trick, and that doesn't have necessarily has AI.
We have a few minutes left. Do we want to discuss as a closing how we can promote innovation into this sector? So you work a lot with many stakeholders and work on co-design, and do you want to tell us a bit more about your approach to making innovations happen? So after you co-design a product, how does this go into the market, and how can you promote it that it's implemented and accepted in the field?
The first thing what we see in Germany, we have outdated stereotypes. So a lot of startups and innovators don't think about older persons if you're not in the care sector. So we talk to fintech, to real estate, prop tech, whatever, nobody sees the market because old is frail and old is poor. So that is what we do a lot, that what we always say is the future is colorful and not gray. So we really have to see how different and fresh old age could be, like we saw yesterday with the judo and with the was a street fight game. And then we really tell the people to talk with your potential customer, not about. So we're all expert and we all talk about old people, so we should have somebody of the audience here who use it. So we always, like you do, really emphasize co-creation and user innovation, and we did a lot of user innovation contests. So we don't ask researchers or entrepreneurs what's missing, we ask the family caregivers and the people in need of care. And that is for us the prime source of innovation. The challenge is the idea needs these groups come up with are very tiny innovations. And that is why companies don't look at this. They always look for the next big thing, the next ChatGPT, which is cool. But there are so many tiny incremental innovations which are overlooked and not run by a company because it doesn't look fancy or fresh enough. So we always look for people who work with what we call tiny innovation or step innovations instead of the really big ones. So it's more kind of a mindset thing.
Yeah, I read an article of yours from you collaborated with Huawei, and you had this term, digital immigrants, which I thought was fantastic. And you need to teach these people, because I remember I taught when I taught my mom how to use the email, it was the most excruciating experience I have ever had in my life. And she was telling me that there was no A on her keyboard, and so I was like, Mom, there's an A on the keyboard for sure. But if you just have a little bit more patience and you teach the seniors how to use it, after a few months, they can use it better than we can. Yeah. Okay, like we saw with Alexa in our nursing homes at the beginning, we used it in the common areas for music. And once they saw that the staff members were just asking this little machine a question, and they would answer, or they would give them exactly the song that they asked for, they started to get creative with it. And they start, in the morning they have the reports, they have the weather report, they have the music, they have the news, they have all these things, and you just have to show them that it's not impossible for them to use it. And like you said, baby steps, small incremental technology improvements, and yeah, you can teach them to do pretty much anything and to use pretty much anything. So just takes patience and time.
And I would add, it takes a lot of stakeholders working together, and I'm always a fan of bottom-up innovation. So you have a problem and you have to find a solution for your problem, and that's how it should start. But on the other hand, you also need a very much top-down support. So you need the government, you need funding agencies to provide you with the regulatory framework to implement that innovation, because you very often have the case that tools work very well with their users, they accept them, but for example you have the questions of reimbursement, who will pay for them. We saw a lot of cool technologies as part of the international awards yesterday, but who pays for them? So you need not only to fund the development of innovation, but then also that innovation being implemented in the care facilities. So you need support from all stakeholders, not just the user acceptance, but all support at all levels, I would say. And especially when your national context is a bit fragmented. For example, in Austria, we have the federal structure. We have the federal governments that have a lot of power, and you often have friction between the states and the higher structures. So we need all those stakeholders to have the same opinion, to work together and enable these innovations to be implemented once the users are happy with them, of course.
I fully agree. And in Germany, we have a interesting situation on the federal level. So we have, I guess, 12 federal ministries, and one is dedicated to families and seniors. We have a health ministry, we have a finance ministry, we have a work ministry. But so every ministry is a bit in charge of senior issues, and that's something for me from a macro level. We really have to see how we set it up, because age couldn't be a layer. Because age is everywhere. You have age discussion now in the workforce, you have age discussion in care, age discussion in health, blah, blah, blah. So we really have to see how we can have a verticals which are aware of seniors, which is much more important for me. So if I talk to the finance ministry, they have to understand that we have seniors in our country have to do their tax report online. That wouldn't work. It's not a senior problem, it's a financial problem. And so also we have to discuss from a federal level to a state level, down to a city level, how do you set up your city hall for senior needs, the needs of an aging population. I think that's always a big challenge. We have to think about how do we get a structure where every stakeholder can find himself in a good spot for his responsible.
Yeah, and I think also depends on, it's always a question of votes and finances, non-taxes. So like in Italy, where every year the senior citizens increase, the government will have to be forced to take care of them more and more, because they're the ones who vote, and they're the ones who are going to get you elected into the next elections, and they're the ones who are going to pay the taxes. And so I think that more and more the government, especially in Italy, will have to cater to the to the silver economy, because it's going to be a big portion of the taxes that they're going to get every year, year by year. So so I agree 100% with you that it has to be a conversation that involves everybody in the country and everybody in the government. So we'll see in the future how it goes.
Thank you very much.
Thank you.
We've run out of time. Thank you also for everyone who listened to us.
Thank you.
And enjoy the rest of the day at Silver Echo.
Thank you.
Thank you very much.